is Karen Blanchard. I work with MetroEHS as their marketing manager. We're so happy that you joined us today on our another webinar series. We're really excited to present this stuff to you all and give you some information that maybe you don't always have access to on the internet. So I want to welcome Casey Callahan. She's one of our therapists at MetroEHS, and she has some great information to share with you. Casey, why don't you take it away?
Hello. So my name's Casey Callahan, and today I'm just going to give you a brief kind of overview of frenectomies, what they are, the implications, and kind of treatment route with them. So let's see, that's my own little guy right there who does not have a tongue tie, as you can see in the picture. So a little bit about myself. So I'm an occupational therapist and I've been practicing 10 years this year. So it's a big milestone for me. And over those 10 years, I just really found a passion and interest in infant feeding and child feeding. So I became certified breastfeeding specialist. I took some Beckman oral motor certifications. SOS approach, which is a sensory approach to feeding and picky eating. Infant and feeding is related to swallowing, some kinesiotaping courses, and recently really gaining a lot of information and knowledge in the areas of ARFID treatment. And of course, I am a mom and have a little family of my own. Personally, I am just really interested in holistic and comprehensive and alternative health methods. That's a big, long way to say is kind of holistic care, which I think is so important and something that we do at Metro as far as working with OT, PT, speech, and really collaborating on these feeding clients. So yes, my little ones are 5 and 8 now, and we love spending time outside and going on little family adventures. And before we get into more of the information, I just want to say we'll have a question and answers portion at the end, but you're also more than welcome to kind of pipe in if you have a question or want me to clarify something as we're going through the information. So what is a frenectomy? You might hear the word ankylosing, TOTS, tethered oral tissues, all kind of referring to the same thing, which is just tightness and restriction in those ligaments and tendons in the mouth. So when that is something that your baby's experiencing, you may need to go have a frenectomy. Different signs that your baby may be impacted are painful latch on the breast, inefficient latch, inability to transfer milk or clear the breast or bottle even, slow weight gain and growth, stressful feedings for baby and the caregiver. That should be a really relaxing, great bonding experience. So that's what we always want to work towards. And also babies who are not getting enough milk per feeding. So you might see them eating every single hour, but not getting the quantity and the intake that they should be getting. So I have a few examples here of some of those things I listed. There's audio on these videos, so it's really more so something you have to kind of listen for, in addition to getting some of these visual cues. So sometimes it's not as obvious, the feeding issues. The baby still may be gaining weight, but the feedings may be taking an extremely long time, up to 2 hours for a feeding. They may be getting a lot of gas or air. It could be causing soreness for mom, blanched little sores on the baby's lips. So those are all signs that although they may be eating, it's not going very smoothly for them, and there's, some different interventions we can do. So for both of these pictures, this little gal was having a difficult time, and we can right away tell by her body language with that clenched up fist and not being super relaxed. So I'm going to play this video and just want you to listen for some of the different noises you hear during the feeding. So just a lot of gulping, clicking, grunting. You can see she's working really, really hard there.
That's what makes a good playboy. You never feel like you're getting played.
Play that one more time.
That's what makes a good playboy. You never feel like you're getting played.
All right, so that one, I don't know if you could hear the audio quite as well, but again, you can hear some clicking and just gotta plug my thing in really quick here. Okay. So here are some pictures of some oral ties. These ones are very, very obvious. But there's a lot of them that are not so obvious. There can be posterior tongue ties affecting the baby's ability to bring the back of their tongue up, which is something they need to swallow and get a good seal and suction. But these are some very obvious ones here. And then you can see the lip, which will really affect their ability to get that nice rounded latch on the bottle or breast. So you suspect your baby may have tethered oral tissues. What do you do next? The very first step would be talk to your pediatrician, let them know your concerns, and they can really make the proper referrals for you. The best thing to do is to start with occupational or speech therapy, someone that specializes in this type of therapy, to start working on some of these different tissues. You can start stretching, working on oral motor patterns. Sometimes you can avoid having the frenectomy altogether. If you can work on some motor planning and stretching exercises, they may be able to avoid the procedure altogether. If it's still necessary, deemed necessary by the doctor, the therapist, an ENT is a great resource. They're oftentimes the one that would do the procedure, but I've also seen it done by pediatric dentists that specialize in that. After the frenectomy, you're going to want to make sure to be working with a therapist to do pre and post care. The post care is very important to make sure that those don't reattach. I don't know if that's the best word, but it's an open wound. So while the tongue is kind of laying in the bottom of the mouth, it can reattach as it heals. And the same thing with the upper lip. So it's really important to just do a few easy stretches, little massaging to make sure that that doesn't happen. So pre-frenectomy, the therapist's role in treatment is really to optimize outcomes of the procedure and aid in recovery. So that's done, like I mentioned, oral motor stretches, strengthening exercises, motor planning and coordination to help getting more efficient with the feeding. Positioning can be really helpful, side lying, just different positioning we can do to slow down the milk flow in the meantime while you're possibly waiting to have the procedure done. And again, really collaborating with the whole team, ENT, pediatrician, OT, speech therapist. After a frenectomy, it's going to be, like I mentioned, just very critical to have those stretches to prevent reattachment, relearn oral motor patterns. Now they're going to have more range of motion, and it's important to teach them how to use that increased movement that they have. Therapists can also make necessary adjustments to the type of bottle you're using, the milk flow. There's a little one there with a nice open latch on the bottle. So I made a quick video here. It's just, I think, 2 minutes long to give you an idea of what this type of treatment would look like. One of the things I really want to emphasize is that it should be a positive experience for the baby and for you. There should be no discomfort or, just to show you it's super invasive. So here's one of my sweet little clients here that agreed to let me make this little video. One of the first stretches we're going to go over is for the upper lip. We're going to gently just do a little massaging and kind of let her accept us into her mouth. She's okay with it, so we're going to slip your fingers underneath her lip and try to kind of flip it over. If it's slippery, you might need to dry your fingers or use gauze to kind of help get a nice grip. We can hold it for 1 to 3 seconds. Another great stretch we can do is to just swipe your finger back and forth between the gums and the upper lip. We can also do the same thing on the lower gums here. We can kind of work towards getting her tongue to follow our finger left to right. And she'll do a little munching and chewing. Our goal is to have her tongue follow our finger all the way around to each different quadrant of her mouth to get some tongue elevation and lateralization. Here you can see she's just doing a little bit of munching, little oral play, and making this a positive experience for her. If the baby starts crying at any time or is uncomfortable, definitely want to kind of hold back and take a little break. Our friend here, though, has been doing these exercises for a while and is super comfortable. So now I'm going to go in with both of my fingers and try to get underneath her tongue on either side, right here where the incision was made. And we're going to lift her tongue up. You want to get back there kind of as far as you're able to. And here we're just doing a little bit more of this oral play on that top lip. If the baby's not tolerating you kind of getting inside and flipping that lip up, this is a great place to start. The goal is really to just get that movement so the frenectomy doesn't reattach itself. All right, and here I'm just going to demonstrate a little bit of a stretch for the neck here. This one is referred to as the guppy stretch. So we're kind of just going to lay her on our lap and just gently release that head, that neck backwards to get a stretch there on some of those neck muscles. Those can really impact feeding. There's my sweet little friend. She was just such a joy to work with. But that was just a way to give you an idea of what oral motor therapy might look like with a child with a frenectomy. So then this is a good time if you have any questions or want me to clarify or elaborate on anything that we kind of touched on. I have a few different examples of some different bottles and pacifier shapes that we may try for different reasons with babies with some of these restrictions.
Casey, I have a question for you. Is there a good bottle to use? Like if you're a breast and bottle person, do you recommend one or the other, or is it just up to mom and baby?
That is like the big question always. So the correct bottle for your baby is going to depend on the shape of your baby's mouth and what they have going on. So it's really impossible. You think about like baby registries and things like that to pick a bottle for your baby before you meet your baby. So something like this Dr. Brown's here on the left, that one's a little bit more narrow, sits further back on the tongue. Some babies do really well with that if they have tightness in their lips and cheeks, because you don't have to open your mouth quite as wide to latch on that. Then the one on the right you can see is, a very popular one that is a very different shape. So a lot of babies do really well with that if they have a gag reflex that's kind of sensitive. But they have to be able to have that nice wide opening angle to latch on that bottle.
Okay. And is that the same? Is that true for pacifiers as well?
Those are even more controversial, whether you should use them, you shouldn't use them. Generally they say pacifiers, you would like to find something that has like a longer cylindrical kind of nipple on it versus some of the ones here, like on the top right, you can see it's flat. That sits in the baby's mouth a little bit different. So there's a ton of different ones to try. So I don't like to pick one specific one. But they can be useful for suck training with babies. But they're controversial on how long you should use them and all
Yeah,
of
that
those.
was my next question, is if it affects babies that have this oral tie, do they prefer, or is there a different pacifier for them? I mean,
Yeah, it depends on the baby. So we'll try different ones. I do feel like it's beneficial to try to get them doing a pacifier just to work on some of those sucking motions and some of the oral play that we're talking about. I personally like the soothing ones where you kind of put your finger in the center and really feel that pattern. So those are always good.
well, this was great. Thank you so much. What wonderful information. What a sweet little baby that we got to see at the end. That was pretty cool. I'm so thankful to have that video. Thank you so much for watching and spending your time with us here at Metro EHS. I do want to give you a little bit of a teaser. Coming up in July, we're going to have a conversation about IEPs, what they are and what that means for you and your family. School is right around the corner, so we want to invite you to join us for that. And then hopefully in August, we can invite Casey back. August is lactation month. And so we want to bring her back and just specifically talk about breastfeeding and how to do that. And if you're struggling, what to do, and what is certified certified breastfeeding? What is this? What is the acronym again? Tell me what it is.
Certified breastfeeding specialist is the credential
Okay.
that I obtained. Yeah.
All
So.
right. So hopefully in August, we can convince her to come back and do that with us again, and such helpful information, and we appreciate that. September, we're going to have a collaborative panel where we have all different kinds of therapists discuss how we work together and what collaboration does to help your child when they come into a place like Metro EHS, where there's all sorts of different therapists that can help them, how it benefits your kiddo. So please stay tuned to our Facebook page for those invitations, and we hope to see you then. Thanks everybody for coming, and we will see you next time. Bye-bye.